Do you find yourself feeling stuck in overdrive at times? Does anxiety and stress have you feeling like you're in a constant state of fight or flight mode? Hi, I'm Dr. Beth. I'm a clinical psychologist and a yoga teacher, and today's mindful yoga practice is going to be a somatic yoga routine with therapy ball self massage to help you stimulate the vagus nerve. Now, if you're not familiar with the vagus is the nerve that runs through the entire body and helps to stimulate our body's own relaxation response. It serves as sort of a brake for that fight or flight system, a way to slow down and soothe. You might think of the vagus nerve as the relax nerve, and it's connected to various areas of the body that we're going to work on stimulating today, including the head and neck, the torso, the abdominal area. So in today's practice, we're going to address all of those things. Be sure to stay for the end. We're going to be doing some delicious work with the therapy balls to really relax and soothe at the end. So you'll need a couple of therapy balls, use tennis balls, use rubber balls, whatever you have on hand, and an optional block as well. Okay, if you're ready, come and join me and we'll start our practice seated. The first thing we're going to do is a breath exercise. So for the vagus nerve, when we engage in any kind of movement with our throat, particularly humming or singing, that helps to stimulate the vagus. It's connected to our exhale breath. So when we extend the exhale, that also helps us to relax. We're going to do both with a humming bee breath. We're going to make a bee sound, a hmm, on the back of the throat with the exhale, and we'll let the exhale be a little longer than the inhale. So let's give this a try. Our mouths are closed. We breathe in and out through the nose. So take a natural breath in, and then on the exhale, engage and make that or humming bee sound. Ready? Breath in. And again, extending your exhale. One more. Let's pause for a moment, noticing whether you're feeling any vibrations in the area of your throat, if anything feels stimulated. We'll do two more, and on these last two, think about taking a natural breath in and then letting that bee breath extend as long as you're able to hold the exhale. It may be a different length than me. Okay, natural breath in. And last one. Return to natural breathing in and out through the nose. You have the option to return to that extended exhale anytime during the practice, and I might cue you to do that. Okay, next, we're going to do more stretching for the neck while also moving the eyes. So eye movements can stimulate the vagus as we move from left to right. Any left to right movement helps to address both sides of the vagus nerve. So we'll start by taking the eye gaze down and to your right. So look with both eyes down and to your right. No need to strain, just look to the extent that you're able to look down and to the right. Keep doing that for a few more seconds. And then switch your gaze, we'll look down and to your left. Might feel a little odd, that's okay. Let's come back to the center. This time we'll add the neck. So look down to the right again. And then let your right ear just drop gently toward the right shoulder, still looking down in that direction. You might let your right hand fall to the side so that shoulder can be soft. Bring everything back to center. Start with the eye gaze, opposite direction, down and to the left. And then let the lateral neck follow. I'm feeling a little tighter on this side. It might feel different for you as well. Again, option to drop the arm to soften that shoulder. And back through to center one more time to each side. So look down and to the right. Let your head drop in that direction while you keep the eye gaze down and to the right. Feel the stretch, feel the movement of your eyes. Back through center. Last time to your left. Look first. Let your head gently fall. Be aware of how everything's moving to your left. And then come back to center. All right, last seated move, we'll grab one of your therapy balls. So we're going to do a little release along the side of the neck and a little bit into the jaw. If you haven't already done my jaw video, I'll link to that below. You might really enjoy all the jaw work we do there. So for this, you'll take the ball in one hand. You can start on whatever ear you'd like. We're looking for that soft spot behind the ear, just above where the jaw begins. And so a little pressure, a little gentle pressure, you might do a little rolling back and forth. You might be surprised to find things are tight in there. And then we'll slide the ball right along the edge of the jaw. You can use a gentle pulling motion to actually tug at the skin, loosen things up along there. And when you get to your chin, go back to your ear. We'll do that twice more. Start with a little pressure, perhaps a little circles or rolling. And then a gentle slide as you pull the ball along the jaw. My mouth is open because I'm talking. You might like to have your mouth a little open, a little loose. One more time. A little pressure. Hold there for a moment, perhaps wiggle or move. And then pull down along the jawline toward your chin. Wriggle your jaw around, maybe move your tongue around in your mouth a few times, rolling it behind your teeth. And then let's do the other side. So starting the same place, that little soft spot, you might feel a slight divot there behind your ear. Give it a little roll or a little pressure. We never want this to be pain. We're looking for sensation. And then gently drag the ball along the area of your chin. You can adjust whether this is a little lower than your jaw, a little higher to your chin. And we'll go again 2 more times. So finding a spot, placing a little pressure somewhere at the top of the jaw, maybe wiggling up and down or side to side. And then gently dragging the ball somewhere along the jawline to the chin. All right, last time. Gentle push. Massage if you like. And then drag the ball down. All right, you can set the ball aside to later, and let's come to our knees. From our kneeling position, we'll be doing a lunge with a twist. So step your right foot forward. Find a stable position. You can widen your feet if you'd like. So this twist will help us stimulate the places that the vagus nerve touches in our center, which includes our heart, a little bit of a heart opening, and opening the abdominals. Let's take a breath in, reach both arms overhead. And as you lower your arms, you'll revolve, you'll twist to your right, taking your left hand across, gently pushing into the side of your thigh, reaching your right arm out behind you, palm forward. Every time you inhale, gently push into the palm on your thigh and reach a little more. And then exhale, come out of it a little bit more. So this is a somatic movement where we're moving with breath, reaching the arm back on the inhale, maybe moving a little into that twist, and letting go with the exhale. You can play around with the position of your arm, changing the shoulder stretch by lifting it a little higher or pressing it back a little lower. And you also have the option of adding the eye gaze that we did before. So looking with your eyes toward your back hand as you push back. Just a few more on this side. Noticing the movement in your whole center body. Let's do one more. Breathing in, twisting. And on your exhale, release. Switch legs. So your left foot comes forward. Adjust the width. Make sure you're stable first. And then let's breathe in. Reach both arms overhead. As you exhale, we're going to twist to your left, bringing your right arm across. Left arm reaches back, palm forward. Now remember, inhale, we gently push in the bottom palm, push the arms back as we twist. And exhale, let your body release a little bit. Inhale, push and twist. Exhale and release. Feeling the movement in your body. That's our internal somatic experience. Adjust the arm to a higher or lower position to get a different sense of the stretch. Option to add the eye gaze, looking toward your back hand with your eyes. Let's do two more. And one more, opening across the heart, twisting back. Exhale, release. Come to front. And we'll do a few more moves lying on the ground, and we will be using our therapy balls here. So come to the ground and find a position where you draw your knees in. We're going to take what's called a revolved abdominal twist. This stimulates around the abdominals. The vagus nerve is responsible for our gut health too. So this is a really good place to stimulate. And then keeping my knees as close to the chest as possible so I can get a little pressure on my belly. Let both knees fall left. Reach the right arm away. You might have to scooch around and adjust your shoulders. And you might have the block nearby. You can place the block under your knees or between your knees if you want a little more support for your legs. I'm turning toward you so that I have my head in the opposite direction of my arms. And again, you can add the eye gaze by turning to the left corner of your eye. One or two breaths here. Last breath. Let's do that humming bee breath on our last breath here. Take a breath in and hum it out. All right, back through center. Adjust your feet. You might want to scoop the hips the other way. Bring both knees in, keeping them as much with that contraction in your belly and toward the chest as is comfortable. And then let both knees slide to your right. Left arm reaches opposite direction. I'm going to look away from you this time. My right hand is on the top of my thigh, gently holding my legs in place. Again, you can have a block here. So this is a spinal twist, reaching the knees in one direction. Upper body is more stable. Head turning the opposite direction. I add the eye gaze if you wish. Breathing in that longer or extended exhale pattern. And for the last breath, we'll add the humming bee breath to the extended exhale. So take a breath in. And then come back through center, and we're going to sit up for a moment to place the balls for our ball back bend. Take your two balls, place them on the mat so that you'll be able to lie down over them. They could be right next to each other or a little further apart. When you lie back down, you'll arrange it so the balls are somewhere along your shoulder blades. And you might have to scooch around, adjusting your balls. And once you lie down, you can also choose to roll so that you go more toward your feet if you want the balls a little higher. Rest your hands on your belly or by your sides. So the balls here provide a gentle arch somewhere in the mid-back. This part of the back doesn't usually like to arch, which can cause some constriction around our heart, and the vagus nerve is all attached in here in the center. So by giving ourselves this gentle little supported lift, we're stimulating the vagus, we're opening around our heart center, we're accessing the breath, we're even getting a little openness here back in the throat. Again, let your exhales be longer than the inhale, so breathe in through your nose, and then long, extended exhale through the nose. Last time, in through the nose, long, extended exhale out through the nose. And then roll to one side to come off the balls. Our last move on our back is that yummy move I mentioned at the beginning. We'll take the block. The block helps support the balls behind our head a little bit more. This time placing both balls on the block. You might have to kind of hold or grab onto them. You might also have to move your hair out of the way. So we're going to come with the balls right at the bottom of our skull. If you have a sock, you could also place the two balls together in the sock. Sometimes that helps to hold them better, or gently hold them with your fingertips. You could also do this over a foam roller. We'll just be here for a few moments, letting the balls sink into that area that's the top part of our cervical spine, our neck, where our neck connects to the skull. Not only is the area of the occipital nerve in the brain, it has baroreceptors. These are receptors they're like our barometer. They help adjust our blood pressure. So they send signals to the vagus nerve to lower the blood pressure, which has a completely relaxing effect on the body. Now you can stay in this delicious position as long as you'd like, or you can join me in a seated position to finish the practice seated. So from seated, we're going to finish with a body scan combined with a mudra. The mudra is called Dvimukam. Palms up, tips of the pinkies and the ring fingers together. And then once you have that, you could lower your hands, rest them in your lap if you desire. So this mudra naturally stimulates the area of the abdomen, again, encouraging our body to move into a relaxation response. And let's do a last little bit of body awareness to stimulate the vagus, moving from left to right. So with your gaze soft or even eyes closed, feel the sense of the center of your left palm. Sense your left ring finger and your left pinky. Keeping your attention on the left side for a moment. And then draw your attention to the center of the right palm. Sense the right pinky finger, ring finger. Going back to the left palm, Sense the entire left side of your body, your left leg, left hip, left palm, arm, shoulder, left side of the face. And then sense the right side, right palm, right hip, your right leg, side of the torso, right arm, shoulder, right side of the face. And then let's bring our attention center, going from the center of our palms that are cupped together to our belly button, and finishing with the heart center, the center of our chest, feeling a sense of openness there, a sense of your own ability to offer this practice to encourage your body to engage in greater relaxation. I really appreciate you being here with me today, and I'd love to hear what were the effects of this practice on you? What was your favorite move? Please comment and let me know. Subscribe so you get notifications of when I do new practices, and I hope to see you next time. Have a good rest of your day.